Food for Thought on News Talk 760 WJR is presented by the Food Bank Council of Michigan, creating a food secure state. Here's your host, Dr. Phil Knight.
Well, thanks for listening, everyone. This is Food for Thought. Several of you asked the other week about the St. Francis of Assisi quote that I used to open our very first show here on WJR, and wondered if I would unpack it a bit and share what I think it means in context of our mission to create a food secure state. So consider again the words attributed to St. Francis. Start by doing what is necessary, then what is possible, and soon you will be doing the impossible. Well, I'm convinced that we have given hunger too much credit for being unstoppable. We have allowed its bravado, its size, and scope to convince us that we can't beat it. And hunger comes with an intimidation factor. It's a bully. And as a result, we've given hunger permission to move us toward appeasement. We use words like alleviate instead of solve. We will talk about it in terms of acceptable percentages and the number of children and seniors who can and will go hungry in our state, instead of discussing hunger in terms of a zero-sum game. So the Food Bank Council of Michigan and our statewide network of member food banks are finished being bullied by hunger. We are amassing a team of strategic thinkers and partners who are determined not only to see hunger retreat, but rather ensure every person in our state becomes food secure. So first, what is necessary? We start by acknowledging that 16% of the people in Michigan are food insecure, and that is unacceptable. Now, it's not enough just to say the fact 16% of people in Michigan are food insecure. You have to say the second part of this sentence as well, and that is, we accept this 16% of people in Michigan are food insecure, and it's unacceptable. That means we're going to do something about it. We start by manufacturing the political and the personal will to stand up to hunger with the determination to enable all who need food to receive it. The primary reason we should take care of this large, intimidating problem of hunger is because we can. We can and we should. And there is a clear moral mandate that no child, senior, or anyone in between ever go hungry in Michigan. The moral argument for food security dwarfs the argument to do nothing. So we will do what is necessary because we can. We have the will and we have the means to do it. Secondly, we will do what is possible. So what's possible about food security in Michigan? Well, first off, Michigan is the second most diverse agricultural state in the United States. Our variety and quantity of nutritious food are more than ample to meet the needs of our residents. First and foremost, hunger is an access problem, but it's not just an access problem. In our state, we have communities that are scarce of food, and traditionally we term these communities food deserts. And we now can identify those areas thanks to some of the work done with us through Dr. Stephen Borders and Grand Valley State University, and we can flood these food deserts, these communities, with food resources, education, and help solve the access problem. Our partnership with Michigan Health Endowment Fund and other funders allow us to share high-value nutritional food paired with cooking demonstrations, tastings, and recipes for fresh produce. And by delivering this program through mobile distribution sites, we are ensuring access to nutrition for Michigan's food insecure population. The Food Bank Council of Michigan, their members serve all 83 counties, and today we are delivering more pounds of food than ever in our history. Well, why is this? Although Michigan's economy is improving and our unemployment rate is decreasing, many of those who have achieved steady income still aren't bringing in enough to make ends meet. The fallout of the financial cliff We now know there is a $6 wage gap between when they lose benefits, a person loses benefits in Michigan, to when they regain the same financial footing they had before they fell off the financial cliff. That's a $6 an hour wage gap. That's hard to make up in any short amount of time. So it is not the intention of any policymaker that I can make myself aware of to devalue work, but that is what our policy does. All, regardless of our political affiliation or no affiliation at all, want people to be independent, so our policy should reflect that value of helping people build wealth and not be punitive for owning something, anything. The cost of certain bills are enough to drive some families underwater financially, and they require food banks to walk into their lives when seemingly everyone else is walking out. Here is what we realize at the Food Bank Council of Michigan. We cannot stay the same and do more than what we have done. We must grow ourselves as leaders, as influencers, in order to do more, to scale to meet the need. We must become innovative and be unafraid of failure, because we recognize the 7 last words of a dying organization is, we've never done it that way before. Well, that will not be true of us. We will grow, we will change, and we will adapt, because too many people count on us, and at that point, we will be doing the impossible, achieving the next level of food security for all of Michigan. I'm Dr. Phil Knight, and we'll be right back.
Welcome back to Food for Thought. Once again, here's your host, Dr. Phil Knight.
Gerry Brisson is in the studio with me. Gerry, the CEO and president of Gleaners Community Food Bank, and our co-host here on Food for Thought. Gerry, welcome back to the studio.
Great to be here with you, Phil, as always.
You know, this is a really exciting show topic for me because it's really about innovative thinking. And we have such a great group of people in our food bank council that are leaders, number one, and they're not resting on the history, the 40-year history that we have. They are really thinking about what will it take for us to go to the next level of food security across the state. And they've come up with some very powerful ideas. And one of those ideas has originated at Gleaners with the My Neighborhood Mobile Grocery. So I want you to unpack that for us and tell us a little bit where that came from and what exactly is it accomplishing.
Yeah, thanks. It's good to talk about this. I want to put in a plug for my other food bank leaders as well. I mean, being on the council with them has taught us so much, and we all encourage each other to rise to the next level. Half the problem is solved, half the problem needs to be solved.
Right.
And so we're on it, and so you know, I like to say that you don't innovate because of innovation's sake, right?
Right.
Our primary reason to have new ideas is to capture the resources that are out there to help solve this problem. And one of the biggest and most important resources are the people who are hungry themselves. They're capable of doing a lot for themselves. And the more we can do to encourage and support them in doing what they fundamentally already want to do, which is get out of this crisis in their life and move on to more success, we need to build programming around that idea. So My Neighborhood Mobile Grocery is one of the ways that we're doing that. We're basically looking at what are the shopping habits of people? How much of their discretionary income are they spending every month on groceries, and how can we help them get more for every dollar they're spending? But we're connecting that to health and particularly accessibility to healthier food. So healthier food at a lower cost, and mobile grocery is accomplishing those things. It's out in the communities where people are. It's small right now. We only have 4 or 5 sites that we're running. We wanted to prove the business model, and here's the concept.
It's a pilot. though.
That's exactly right.
Yeah.
It's a pilot right now. The concept is this. We want to drive $1.40 in value for every dollar someone would have spent in retail through this mobile grocery initiative. And we put a very small but significant selection of food on a mobile truck that goes out into the community where people are and says, if you get these foods from us with your EBT card, which is SNAP, which is food stamps, right?
Right.
Then through the various incentives we can offer people, as well as the food that we have access to at Gleaners, we can drive that value, $1.40 for every dollar they're going to spend. So if you get $10 in SNAP or food stamps or on your EBT card, that can be $14 in return to you using this program.
Wow.
Yeah, it really is amazing. And I've got a great team at Gleaners who really knows how to buy and get the food out there at a low cost.
So just thinking about the history here for a minute, this has been tried across the U.S. at different places, more than 200 food banks in the Feeding America network. Several of them have tried that, Gerry, and they've not succeeded. What makes this model at Gleaners more sustainable than what those past? I'm guessing you learned something from them.
Yeah, we absolutely did. In fact, looking at the models that have been done, most of the models look like a bus that has produce in it that can drive around and people can just shop for produce. That's how most people have tried to do this mobile concept. There are small farmers markets and other things that have been tried as well. But what we found is those models generally relied on foundation support to get started. And while the idea was good to improve access, and certainly we got important learnings from those efforts in terms of what people will eat and want to consume, the long-term sustainability from a business model standpoint never proved out. And so they would last 2 or 3 years, the funding would run out, and then they would close. So we started with the idea that you have to have a sustainable business model. The foods that people buy have to be, what they want and need, and what their habits say they're willing to buy, and we have to provide that at real value. It can't be, real monetary value, right?
Sure.
So you start with including all the costs to distribute that food, all the staffing, everything. You build that all into your business plan and then say, from that, what are the foods we can get at a low enough cost so that we can afford to keep this program going?
You don't sound like a do-gooder to me.
You know,
you sound like a businessman or business person who's created a sustainable business plan, but your mission is just different.
That's exactly right. And when you talk about social innovation particularly, that's what you're talking about. You know, that triple bottom line. And one of the parts of that triple bottom line is, in fact, the financial bottom line, right?
It doesn't do any good if it's here for 5 years and then goes away.
Or even, 2 or 3 years, which is what the average has been. So what we did first was prove out the business model. Here's the food we can offer, and align that business model with consumers' wants and needs so that we could come up with a list of things that we could offer at a significant savings, but that's also healthier and convenient.
So I believe thoroughly that money flows to a great idea, whether you're in business or in social innovation or whatever you're trying to do. And that's been true for my neighborhood mobile grocery because the American Heart Association has come alongside of you to help market this. And not only that, the USDA is looking at helping you with the grant of a waiver so there can be prepayment and post-delivery of goods. That's got to make you feel great about this idea.
It really does. I think we've gone about this in the right way. Prove the business model first, show that it can be done. Our next step is to take this to consumers in a way that will make them go, yeah, I want to do this not just once, but I want to make it a regular part of my shopping experience. And the Heart Association, I just want to put in a plug for them. They are looking for creative ways to help people improve their health. Health is one of the main things that causes food insecurity, health problems, that is. And so we're partnering with them because our program gives an alternative for people to get healthier food more consistently into their diet.
Great idea. And, there's another idea on the west side of the state. That's called the Community Food Club, where 7 nonprofits came together in Grand Rapids to create a store, a shopping experience, a retail experience. And the Feeding America West Michigan has been pivotal in that. And it's a club, kind of like a Sam's or a Costco, where people pay into that. And we're also seeing how that fits into the Employees Resource Network that we had Dwayne Berger on to talk about. And in this model, the people are paying a membership fee, and they're getting access to great food, but it's on a point system rather than on a price system. And it's just a spectacular innovation to complement the My Neighborhood mobile grocery. I'm just thinking that I'm remembering that Alan Kay said the best way to predict the future is to invent it. And I think that's exactly what you guys are doing with these innovative thoughts. We're going to come right back here on Food for Thought and talk with Ken Estelle, the CEO for Feeding America West Michigan, about a very exciting project that we think can change food security across the entire state.
It's Food for Thought with Dr. Phil Knight on WJR. Get in touch with the Food Bank Council of Michigan. Visit fbcmich.org. Once again, here's Dr. Phil Knight.
Welcome back, everyone. Dr. Phil Knight here with Gerry Brisson, the CEO at Gleaners Community Food Bank. And Gerry, right now we have a guest, our compatriot, our partner in this great mission of food security across the state, and he is Ken Estelle. He is the CEO and president at Feeding America West Michigan. And Ken, your food bank, Feeding America West Michigan, literally covers half the state.
More than half.
That's right.
40 out of 83 counties. And
we cover a lot of area, yeah, from the west side, all of the lower peninsula, all the way through the UP.
I think when I was in your office for the first time, you explained to me it would be like driving from Detroit to Atlanta.
Well, it's a long drive. We were one of the few food banks that had to use over-the-road trucks to get from one end to the other. But, it takes a good 10, 11 hours to get from our Benton Harbor facility up to our facility in Hancock, Holton area.
Wow. Well, tremendous work you're doing, and one of the reasons we wanted to have you on the show is not only the great impact you're having across the western and the upper peninsula, but also because of some of the innovative opportunities that you've helped to create on the west side. And the name of that is, I'm just going to throw it out and let you explain it, but we call it an IQF project. And help us understand what that means.
Yeah, we've been working. The IQF is an instant frozen process where it stands for individually quick frozen produce. And what we've been doing on this side of the state, we have a number, almost 10 large frozen processors that produce millions and millions of pounds of food for the retail industry. Basically, when you go to the store and you buy the frozen bag of corn or peas or something, that's what they produce. We've been working with these folks for some time, and what's happened and what we've developed is a relationship where some of the produce that they freeze in their process gets rejected because it might not be exactly the right size when it comes through the process, or the color might be just slightly off, or there's some cosmetic imperfection, but the food is certainly safe and good to eat, and it gets rejected. And for years they were basically throwing a lot of that away. And what we've worked with initially, we worked with Arbor Farms in Walkerville to capture that product and donate it to the food bank, where we then take it and inspect it, repackage it into family-sized portions, and distribute that throughout our service area, and in fact share it with food banks around the state. And so that's exciting. The one farm that we're working with so far, Arbor Farms, produces about 200 million pounds of this frozen product annually, and they estimate they can donate between 2 and 3 million pounds a year of the product that would get rejected off their line. So that's what we're capturing, and that's just one out of the 10 companies that are currently doing that in our service area.
So when we talk about that, I know that when people hear millions of pounds, it's hard to put that into perspective. So as you think about this, Ken, when you say, okay, 2 or 3 million pounds from one, there's 9 others to go, how do you describe the opportunity both for the food bank and most importantly for the people that we're trying to serve?
Well, I think for us as a food bank, I mean, what we've always tried to do is capture more healthy product. And so the first point is this is really nutritious product, and the way it's processed is all of the nutritional elements are captured in this freezing process. So point one is it's really healthy product, stuff that is really highly desired. And so from a ability to be able to get this type of produce year-round is very exciting for us. But for the families that use it, again, it's one of the healthy products that you can get. It typically is fairly expensive in the store, so a lot of the families that we serve just simply can't afford to purchase this. So getting this type of product to the families we serve is a real advantage. And just to kind of comment on that in terms of the families, when we started the program with Arbor Farms, I'll also put in a plug that we were able to start it with a generous grant from the Michigan Department of Environmental Quality, DEQ, which helped us get this started. And we started that by partnering with our partner food bank in Flint as a kind of an outcome of their water crisis. And these products that are being frozen are really deemed as some of the most effective in combating lead in terms of their ability to help body restore. So we actually have an initial partnership with our friends in Flint to help because of the nature of the product. It's so important from a nutrition standpoint. So we're really excited about that.
And how did it happen? How did you get word of this just to start this off?
Well, we've been working with Arbor Farms and many of the others who donate periodically. They'll just have whatever reason they may have had excess production of a product, or they've switched over a product and they ended up with some product that was donatable. So we have gotten sporadic donations of finished product from these processors for years. So I think it actually started with my food acquisition team and the routine meeting that we do with our donors. Our food donors went to their facility, and we're watching them run the line, if you will, and they're saying, well, what is happening with all of this product that goes into this, what looked like kind of a separate bin? And they go, well, that's the product that gets rejected and it gets thrown away. And my team looked at it and go, well, this is perfect. Why are you throwing it away? And they say, well, it's the wrong color or the wrong size, or it had some blemish on it that it was rejected. And that's how we started the discussion. We said, well, what if you were to donate that product to the food bank? And again, at that point, they had never thought about anybody actually using that product. So it was really my team who just happened to be there on a routine donor meeting, saw the product, and that's how we got started.
Wow, that's awesome. Well, Ken, you are covering 40 out of the 83 Michigan counties, and I think and you're the first person we've had on the show that is the CEO and leader of a food bank across the state, other than my esteemed co-host Gerry Brisson here from Gleaners. But I felt like the reason I wanted to ask you this question first is because you're covering 40 out of 83 counties, and if you believe this is possible, then the rest of us need to just follow that, get right in line with that. So I want to ask you, as the leader of Feeding America West Michigan, covering 40 out of 83 counties, why do you believe that food security is obtainable?
That's a great question, and I will tell you right off the bat, we absolutely believe it's attainable. It's our mission, and I think there's a couple of reasons, but the primary reason that I think most of us who lead food banks would agree is that we fully believe that there is enough food in our area to satisfy the need for everyone. Certainly in the service area we cover, that there's enough food in the area to be donated and acquired to meet the need. So there's no question that we have that food. Unfortunately, today the challenge has been we are not still able to capture all of that food that's available for various reasons, and a lot of it relates to cost and infrastructure. So if you believe the food is there, you have to believe that we are smart enough to figure out how to get the infrastructure where we need it to obtain the resources that are required. In our area, because we serve such a large area, it is mainly rural. We have a few urban areas, nothing to the size of Southeast Michigan, but most of our communities are rural. So for us, the challenge is getting food into rural communities, and to do that, obviously, you need the trucks and the ability to move the food. And so for us, the challenge is building that capability to get food into these rural communities where most of the people we serve live.
Ken, how can folks across your service area get in touch with you?
The best way to get in touch with us and find out about what we're doing is on our website. It's very simple. It's feedwm, that's feedwm.org.
Awesome. He's Ken Estelle. He is the CEO and president for Feeding America West Michigan. Ken, thanks so much for being on Food for Thought with us today. And I'm quite sure that this won't be the only time that we ask you to come on the show with us.
Well, thank you so much for having me. It's been a pleasure.
Thanks. He's Ken Estelle. He's the CEO for Feeding America West Michigan. I'm Dr. Phil Knight. Gerry Brisson is in the studio with me. You're listening to Food for Thought, and we'll be right back.
You're listening to Food for Thought with Dr. Phil Knight.
Gerry Brisson, the CEO and president of Gleaners Community Food Bank, and my co-host here at WJR is in the studio, and we're talking about innovation. Great segment there from Ken Estelle about the IQF project, Gerry. Amazing the amount of potential that project has.
No question. And another example of there are more resources yet to bring to this problem, and not just fundraising. I mean, when we talk about this in the nonprofit world, people always think resources means asking people for money.
They're synonyms.
Yeah, right. But it's, and of course, that's part of what we do. And there's a lot of very generous people who help us out of a sense of charity.
Right.
But when we're innovating around the issue of food insecurity, we've got to think past that, and we've got to think about what other resources are there to bring to bear to solve this problem. We talked about people bringing it themselves.
Right.
Then we talked about this whole resource of frozen individual food, broccoli and things.
Right.
That's just out there that we got to capture and figure out how to get in the system. And there are other ideas, and I know one of the ones we've been itching to talk about is integrating with healthcare.
It's we've got about 20% of the total population using about 80% of the health care. That's what we're told. I just attended a conference in Chicago, Root Cause Coalition, one of the best conferences I've ever attended, and they talked about the 4 social determinants of health. And the first one that they mentioned is food insecurity. And so we know that for us, it's kind of a multifaceted approach. We know we can't scale charity to solve this problem. You just can't consistently raise double the amount of money that we need right now to meet double the need, right? But you just can't do that consistently. So what we have to do is look to see where we add value into different businesses, and that then food security becomes part of their business plan because we're returning on their investment. And I think healthcare is the first place that my mind goes to, and the conversations that we've been having and that you've been having in particularly is leading us to believe that those thoughts are correct.
And let's keep in mind, the folks in healthcare are smart, and they add huge resources just from that perspective. These are well-trained, very intelligent, up to knowing, well, what do they know now about how food contributes to the health of their patients? What do they know about, for example, it's a huge percentage of prescriptions that say take with food. So if you know you need food for your medicine to work, which they know clearly, we can help fill the gap of then how do you get food to the people that need it so that their health care is working for them.
And, there's a big shift here in the 40-year history of food banking. And that shift has really happened more recently with a greater emphasis not just on any food will do, but healthy, nutritious food, access to that kind of food, fresh fruits and vegetables. Last year in our network, the 7 food banks and the Food Bank Council, we distributed about 39 million pounds of fresh produce through our network. And I'm going to say over 90% of that was Michigan grown.
Yeah, it's amazing what a tremendous opportunity there is in this state to connect those dots, the food that's available, the healthy food that's available regularly, with the need to get that to people whose health, when their health improves and their food security improves, there's a better bottom line for healthcare. And, we're going to be talking about healthcare probably for the foreseeable future as a cost that we need to contain in order for us to have the healthcare we want and need. Food plays a significant role in that. Everybody knows it. So the opportunity to innovate is to take what we know. Food is critical. Everybody needs it. There's not enough of it for everyone that needs it, and that the patients that hospitals and doctors see need not only healthier food, but which foods they need to know which foods they should be eating and regularly have access to those.
So can you outline maybe a bit of the model that you're thinking about and maybe some of the potential partners that you've been having conversations with?
Sure. So we've been talking to practically everyone involved in healthcare, from insurance companies to hospitals to doctors to, people in systems. And there's partnerships at every level. We have partnerships that are attached to Cooking Matters, which is how we teach people how to budget shop and prepare the right foods at home, right? That's part of the plan, because not everyone just needs food. They also need to know a little bit more. Again, what can they do for themselves? So Beaumont, Henry Ford Health System, St. John Providence, all of them do Cooking Matters in partnership with Gleaners as a way to reach patients with information, not just food. So that's really important. But we look at healthcare, 3 things that we think we can help play a role. First is hospital readmission. If someone leaves the hospital with a chronic condition and they're low income, the likelihood is that they are food insecure. So we're working on ideas to help get them food as a way to keep them from having to come back to the hospital, because when they got home, they couldn't treat their condition because there was no food in the house. So that's one big area that we think there's a significant partnership to be had. The second is chronic disease treatment. I'm not in the hospital, but I have diabetes or heart disease or hypertension, and what I eat significantly affects how much care I need for all of those diseases. So we think that there's a partnership, especially for the people we serve, the low-income folks who maybe aren't buying all the foods that they would need for the right diet because they're too expensive or they don't have regular access to them. So we think there's a right partnership there with healthcare to help drive better costs and better results there. The third really is prevention. We know that 80% of the money we spend on healthcare is related to 20% of the solution, right? 50% of the solution is about lifestyle, and we only spend about 10% of our healthcare dollars on that 50%. So prevention is another huge opportunity for us to look at how do we help healthcare accomplish its missions of better patient care, better outcomes for the community, and lower costs.
Wow. So all of that, here's what strikes me about that, is that this has not been done before. And so you're having to build an entire process, and maybe for each of them, I'm sure some of the process components will transfer from hospital readmission to chronic disease to prevention. But still, Those are three distinct and unique processes that have to be built as you're dealing with different people and patients and their needs.
Exactly right. And I think hospitals have been looking at it, and there are programs we can look at and learn from. And so we're not starting from zero, but we're really starting with a perspective that the food bank, which has not been involved significantly in this, can probably have a role in making the system better.
I hear you. So do you think some of the folks that you're working with on this this great hospital or healthcare integration would be willing to come on Food for Thought and talk with us about this?
No question, and would have so much to contribute to this conversation because, as I say, they're very smart. These are very smart people who are real serious about making sure that their patients are healthy.
I think it's a big part of innovation is when you start thinking about who wins when we win. When we solve food security, who's going to win? And I think healthcare and thereby all of us in the population are going to win big time with this idea. I love it. I love the idea. This is Dr. Phil Knight. I'm with Gerry Brisson. You're listening to Food for Thought on WJR.
It's Food for Thought with Dr. Phil Knight, presented by the Food Bank Council of Michigan. Once again, here's Dr. Phil Knight.
Lots of talk today about innovation. What's the last word from you?
The last word is this can be done. This can be done, and that's the point. And we want to be specific enough to say this isn't just pipe dreaming. There are strategies being employed to solve this problem in new ways, and they're going to work.
Awesome. Well, here's some food for thought for you. Steve Jobs said, innovation distinguishes between a leader and a follower. While food banking has built an impressive list of accomplishments over our brief 40-year history, we recognize that what got us here will not take us to the next level in our mission to create food security across the state. We've done a lot of good for a lot of people, but we also know the 7 last words of a dying organization are, we've never done it that way before. The CEOs and executive teams of these 7 extraordinary food bank organizations are innovative thinkers who are creating unique, inspiring, and excellent ideas that lead to solutions to meet this need. So if you're concerned about this problem and understand solving food security can be solved, that it can be solved and must be solved in order for our economy to grow, our educational system to thrive, and our health care to be less noticeable in our lives and our pocketbooks, then join us. Find us on the web, like us on Facebook, and volunteer yourself, your family, and your business, and become a hunger champion. And together, we will solve this very solvable problem of food insecurity. This is Dr. Phil Knight for Gerry Brisson. We thank you for listening to Food for Thought on 760 WJR.
Food for Thought has been presented by the Food Bank Council of Michigan, creating a food secure state.